So are there any risk factors associated with having hyperacusis, Kathryn?
Right, I'm going to slightly face another screen now because we've recently done a project. We've recently been doing research has so many weird terms for everything. So we do systematic reviews in research, and this is where we would look at all the research that has been done on a particular subject, and we would have inclusion criteria. So we'd have criteria that we want to look at across these papers that have been done, because we always publish our research. So with the systematic reviews, this is one of the ways in which we can look at prevalence figures or risk factors that have been associated with them. And what we do is we look across all the research and we pull in anything that's hyperacusis and anything that they say risk factors, and we make sure they're right. So we've recently this is literally just been done in the last month or so, looked at some of the risk factors in hyperacusis. Now, as I'm sure you're aware, Rupert, we don't necessarily diagnose hyperacusis right now. So some people will be self-reported hyperacusis, and some of them will have been to their clinician and been told it's hyperacusis. So whenever we look at risk factors, we do kind of separate them out in that way. So the ones that have been diagnosed or by a clinician, we'll look at them versus people that haven't. So for people that risk factors around people that have been clinically diagnosed, post-traumatic stress disorder has been associated with hyperacusis. And at the moment, the risk factors that we're looking at are more around conditions that are linked rather than sort of if you were drinking a glass of wine, whether that would make a difference. But obviously, tinnitus is associated. Migraines are associated with hyperacusis, irritable bowel syndrome, chronic fatigue syndrome, anxiety disorders and just depression are associated. So quite a lot of them are very similar to what we've seen with tinnitus as well, kind of the associated risk factors there, muscle disorders. So it's quite a lot of, interestingly, quite a lot of other medically unexplained kind of conditions all seem to be interacting with it. Migraine is one of the ones that's quite commonly reported, which as someone that suffers from migraines, I would say that during my migraines, people either can have visual problems with their migraines or hearing problems. I'm definitely more down the sound side. So whenever I get a migraine, it's definite silence. Otherwise, yeah, it gets progressively worse. But we've found that a lot of people are reporting that problem with the kind of sound sensitivity continuing after a migraine and actually carrying on. In self-reported hyperacusis, again, it's the same sort of problems are being reported, but then you've got things like ADHD has also been associated with it, and that's probably panic disorders. So yeah, there's something there with other conditions. This review didn't actually find anything on dementia, but we do know that there's a big link between dementia and a lot of sensitivities, so not just sound, but sound is one of the ones that they're having quite a lot of problems trying to deal with as well.
Oh, wow. Yeah, that's a great answer.